Planning Council, and I want to also invite up Dr. Larry Gasco, the chair of the Los Angeles County Mental Health Commission. You'd all come up together and share a few words for our Southern people. Welcome.
Good evening, everybody. So, Marv, I guess it was 17 years ago. 17 years ago, about 3 blocks from here, Marv came to me with the Asian Pacific Policy and Planning Council in an evening meeting. I think it was a Thursday evening, from what I remember. And in that meeting, I guess Marv kind of preempted us. He told us that in his tenure in the Department of Mental Health, he was interested in reducing disparities among Asian Pacific Islanders, and he laid out the statistics about underutilization and about that, and he asked us to join with him as a partner in transforming the system of public mental health care into a recovery-oriented system. And at the same time, he committed to working with all of us to develop a system of care for Asian Pacific Islanders. And every year or every 2 years, we would meet in his office and review the status of it. And Mark, I'm just we're grateful because in the current status, the network of care involves 2 directly operated mental health operations, fully staffed, fully operational, and 12 other community-based API agencies, culturally competent agencies, and today will likely exceed the service of 10,000 API individuals in this particular district. So we are extremely grateful as a network of providers, but I think more importantly, the API communities in Los Angeles are grateful to you, Mark, for your leadership and certainly your guidance in making this happen. And I think in our best thinking, as Rita said, we don't see going backwards, but going forward because of your work. Thank you very much.
We would like to take a moment to present something special to you.
It's not a chair.
No, it's a boy, it's his bird.
It's for your office.
It's a great honor to be able to speak, especially such a distinguished the people that are here present today to honor Marv. I have to admit that it's with great sadness that I see him go. It's a little personal thing for me. For those of you that don't know me, I'm Larry Gasco. I'm honored to serve as chairman of the Los Angeles County Mental Health Commission. We always talk about Marv's leadership and his vision. But during his tenure, 17-year tenure, people have ideas, people have initiatives, but Marv's, I'll give you a couple of examples. Marv's vision was just extraordinary. It was very moving. I remember one of his first things, very early in his 17-year tenure as director, he made the promise to provide a school-based mental health program to any school in Los Angeles County. I was basically floored. I said, well, that would never happen, but it did, and it did because of his leadership and his following up. Much later, during his tenure, we came up with something called the health neighborhoods. Frankly, I had no idea what a health neighborhood was, but as I became more informed, this is one of the most extraordinary initiatives that anyone could dream of. And of course, this is Marv's idea, and put a lot of energy into it. And those are just 2 small examples, and there's so many more that I could talk about. But I would like to talk a little bit more about Marv Sutter, the person. Marv had an ability, I can't tell you the number of times I saw him speak, a variety of audiences, different themes, but he always brought to them a certain freshness, a certain enthusiasm, and it really communicated very well to whomever he was speaking to. Now, Marv, personally, I will miss very much whenever you use a Latin or Greek word as the major theme. I just always found it really great. So I miss it when you sort of got onto some of the later themes. But Marv is a person, anyone that's dealt with him, he was always available, very accessible to whomever sought some time with him. And that, whether it be organizations, whether it be groups, whether it be individuals, Marv always spent the time. And during the last few weeks since Marv announced his retirement, I can't tell you the number of people that have come up to me and said, I came across Marv and he actually spent time with me. That he just walked by because he's a busy guy. And I think that just indicates a small indicator of the integrity that Marv has. Any of us that have worked with him know that very well. And on behalf of the Mental Health Commission, Marv, mil gracias.
Before we hear from the most important person in Marv's life, his wife, Carolyn, I want to invite out the DMH Executive Management Team and Planning Committee for a brief presentation.